Okay, here we go. So this video is about Accutane, the miracle acne drug. This probably should have been my first video, and I probably should have made this video 10 years ago, when I thought I had fixed the long, permanent, lasting side effects that I had been left with after taking this drug. I'm going to do a brief rundown of what the drug is and just how devastating it can be to lives, particularly after the drug, and the permanent changes that it makes to your brain, to your body, and there's no cure and it can't be reversed. So Accutane, as it was originally called, was brought to market in 1982 by a company called Roche Medical, and that was why it's called Accutane. Originally designed to be a chemotherapy cancer drug, causes cell death. That's its job, cell death. During using this for cancers, a side effect was noticed, pediatric cancers I should say. A side effect was noticed that some of the acne was going away at the same time that they're being treated. So as we know, and not to be negative, but I guess it is a serious subject, money rules everything, including people's lives and health. Drugs are there to help, but not all drugs, and most, if not all drugs, are here to make money, and we're talking trillions and trillions of pounds. So brought to market by Roche Medical, originally a cancer drug, remarketed as an acne drug. So within the first year of being on the market, the FDA are already on the case of Roche Medical, reports of suicides, Crohn's disease, brain diseases, the list is endless. Numerous new warnings have been added to this drug ever since it was brought to market. Almost every year there's been another thing, another depression. It went from saying may have mood changes to may cause serious mood changes, may cause suicide ideations. Then they were forced to add suicide as an actual side effect. And there have been thousands of suicides for people after this drug. So I want to explain quite how damaging this drug is. So I took this drug when I was 16 years old. So you got to bear in mind, not all teenagers get acne, but if you get acne as a teenager, it makes an already difficult time in your life a little bit more difficult, right? So every child that has acne doesn't want acne. They try all of the things they think will work, face washes, creams, and it doesn't go away. So they're desperate, and I remember being desperate to not have spots all over my face, oily skin, and obviously the parents of the child would like to help them too. So trusting our doctors, our NHS, and the drugs that we are given, parents then take their children in to get this, or to speak to the doctor, and they're put on Accutane. So this drug, for me, I tried everything for my acne. well over a year of all of the creams, all of the, you know, try just water to wash, soaps, tried everything. Nothing touched it, you know, nothing made my spots even slightly better. Started on Accutane, and I remember, I think within a month, every single spot had gone, and my skin was like spotless. So I just want you to try and take into account just what that drug has done to be able to cause that. Obviously, you're very happy though, as a teenager, you're very happy that your spots are gone. But, and the doctors tell you, when you ask how it works, or, you know, because you have to go to a hospital and there has to be lots of signings now for how it works, the doctors will say it reduces the amount of oil that your skin makes. So that is probably the most basic way of explaining its final outcome of how it is affecting your body. That is on a hormonal level to the point of shutdown. DHT in particular, which is the most crucial hormone in a man. It's what causes lots and lots and lots of functions, and shuts down a thing called 5-alpha reductase, or it reduces the receptor. It does this, which then means hormonally everything drops. Growth hormone, testosterone, estrogen, all of the levels drop, to the point where early growth plate closure is reported as a rare side effect. But if you're giving this drug to teenagers, you know that you're around that time of sort of stopping to grow, so it's not noticed as much as it should be. It definitely happened to me, and yeah, and it's listed as a side effect. Funnily enough though, if you Google list of Accutane side effects, there's a kind of a basic list. It's not until you Google certain specifics, like until you say early growth plate closure, that it then comes up with the studies and all the evidence showing that yes, it can cause that. So it's still hidden even then, and they call it early epiphyseal closure. So who would know what that is when you're looking at down a pamphlet, and the doctors don't tell you. So that's early growth plate closure. So let's say 2, 3 years, 2, 3, 4 years before your body is meant to stop growing, this drug can shut down your growth and all of whatever else goes along with that. I know this drug is given to children as young as 14. And on the forums, there are parents and people that are just absolutely devastated that they have like a 14-year-old son that's gone in, been given this drug, and then they don't grow after that. And that's just one of the side effects. This drug, within 4 months, was shown to cause a 20% reduction in the frontal cortex activity of the brain. Important for mood. It's basically, it's a really important part of the brain, especially when we're growing. 20%, average of 20% reduction in activity of the brain shown in brain scans, an official study. The suicides that happened within the first couple of years of this drug, and the FDA actually confirmed that these were confirmed suicides related to Accutane, was in the thousands within the first couple of years. Abortions, linked to Accutane or because of Accutane, tens of thousands. The suicides that have gone unreported, there are loads of, and it's a drug that is so aggressive and so harmful that I cannot believe that 25 years after I took it, it is still being given to children to help with their acne. What adult that's say 50, 60 now, that had spots when they were a teenager, still has spots now? I mean, even a little bit of scarring is nothing compared to what this drug is giving people permanently after. The way it works is by altering your genes and shutting down the brain, part of the brain and part of the sexual axis, the way the brain and all of those things work together. And for years and years and years, sufferers of this drug on forums have been trying to work out how to fix this, can this be reversed, and there's still they're no closer. And there's some very smart people. There's lots of trials of different drugs. For example, I went on testosterone replacement. It made me feel better, but I still suffer a lot with mental health, and I still have issues relating to sexual function, which has haunted me since I was 16. And then, so I want to know, like, they keep adding. They just added another warning this January. They've added new guidelines of how to give this to children, what you need to say, what they need to sign off. It's they must be monitored for mental health changes, sexual changes, any suicidal thoughts. What teenager that's 14, 15, 16 knows what their brain is doing, knows what their hormones and thoughts and feelings mean, or even if there's a rare case they do, is going to open up and talk about it or understand it? I don't think there's any other word other than it's disgusting that this drug has been allowed to stay on the market. One of the FDA workers in the FDA said himself that this is one of the biggest failings in the history of the FDA, that this drug has been allowed to, and still being allowed to be prescribed. Lots of reports of a 90% saying that people that have been given the drug didn't even have severe acne. It's meant to be for severe cystic acne, the strongest type of acne, and even then I would say still not worth it. No way. The side effects that they list on the packet, they tell you it's possible, rare, and that's during when you're taking the drug. They're permanent, not in all cases, but in a lot of cases they're permanent, and these are for the people that have actually worked it out. I didn't work out what had happened to me until I was 32. I was absolutely in the darkest, most depressive hole from 16 to the rest of what I'd call my early adult life. And it wasn't through going absolutely mad and like continuing to say that I don't know what's wrong with me, that I managed to stumble across these forums and find out, oh my God, there's loads of other people talking about this drug that they also took and how they're suffering with the same things as me. A documentary in 2012 called Dying for Clear Skin, BBC documentary about the suicides linked to this drug, and that's in 2012. And how some parents have just been left with, a young teenage child that has gone from being very happy and very healthy to months later, just because of a drug to fix their spots, committing suicide. I was very active, sporty, tall for my age, or at least, one of the tallest. Didn't smoke, didn't drink, like very confident. And then, I just went into I completely changed, and it was just, from then on, it was just a dark time. But at the time, you don't know. You associate it with other things going on, and it's such a difficult time in people's lives that this drug is being like disguised by the fact that it's being given to children and teenagers. So obviously I sound quite angry about it, and it sounds very serious, but I think what it is, in again, thousands of people on the web, tens of thousands of people, is that you live with it alone. It's hard to describe, it's hard to prove, and even if you go to the doctor and you ask them, like I did 10 years ago, I feel like this drug has done this to me, they'll tell you that it probably hasn't, or it was probably due to something like this. Even the doctors do not understand. A general GP, I believe 99% of them do not understand the mechanism of how this drug works, how serious it is, and what they're giving to children. It's, yeah. So if you're going to if you are on it, or if you know somebody that wants to go on it, or if you're a parent that has a child that is asking you to please let them go on it, from my experience and from those that are living the permanent side effects of this drug, just please don't let them. Do research the hell out of this, because the internet is absolutely scattered with the negatives of this drug. The list is endless, and they're serious, serious. It's marketed as a drug that reduces the sebum, the oil that your skin makes. Like, so, when I got it, I went, oh great, like, my spots have gone, amazing. Which is another reason why, when these brain changes are happening and the psychosis that it can cause, it's disguised again because the child is a bit happier because their spots have gone. So the argument, yes, the child, well, it can help people's lives at a time when they're really feeling down about their spots. Yes, of course it's going to help them. Like, the spots have gone. Like, that's, I think, the only positive of this drug, is that it makes your spots go, because it, chemotherapy wise, wipes out your body, and it causes permanent cell death. So the cells that it kills, you can't reactivate them. The hormones that you put into your body, you can't reactivate. The drugs you take to activate the brain, the parts that improve dopamine and serotonin, the brain doesn't respond to them, because it's shut down these receptors. It's so complex, it's so damaging, and it is just the most disgusting drug that's ever, well, not ever, flutamide was terrible. That was also given to thousands of people until they brought it off the market. I can't believe Accutane is still on the market. And maybe I should have made this video 10 years ago, but I remember when I had to leave it behind. No one in my family kind of knew what I was talking about. Doctors didn't know what I was talking about. It's only because, even though all of the information and all of the evidence is saying it's possible and all of these things could happen, you're still not left with anything to go with. So you end up going mad. And then when I started hormone replacement, I felt a little bit better. I just thought, I can't carry on with this. I wanted to speak out about it then, and I was just like, I have to let this go, because it's killed me for 16 years of my adult life. The reason why I'm speaking about it now is because previously talking about testosterone replacement therapy has obviously brought it back up again, because the reason I'm on testosterone replacement therapy is because I had really low hormones, and I would, almost undetectable and so low, and they must have been, I'm pretty sure they would have been like it since I took it. Yeah, so that's why I'm talking about it now. I also, from thinking about it and from going through a bit of a difficult time at the moment, I went back online into some of the forums that I'd used 10 years ago to hear other stories, find some research, try and delve into like what can help and what might improve. And it's just the same stories, but just loads more people. And then there's even more things being added, and I didn't know that these receptors and everything were shut down permanently. I knew the effects it caused, but it's a lot. So funnily enough, you know, a few years after bringing this drug to market, Roche Medical, bear in mind this is making them trillions and trillions of dollars, they stopped making it because of the amount of the millions and millions of pounds in lawsuits that they were having against them for Crohn's disease, for suicides, for liver failure, for everything, you know. They stopped making it. So, you know, and there's still one going now, and I don't know why it's not talked about in the news. And I just don't think well, I definitely know that parents and the children that go to the doctor to take it are not aware of it, exactly how serious this drug is. You know, I remember it didn't matter what was on that pamphlet. You know, possible, rare, very rare. You don't take any notice of it because you're just like, oh my god, I'm going to finally get rid of my skin. I've seen other people take it, like, their acne's gone. It doesn't matter what it says, but you're a child, 14, 15, 16. You're a child. Like, you're not in the place to make those sort of decisions, and you're not even given the correct information from the doctors. So, you know, it shouldn't even be there as an option. I know they give it out for people that have a couple of spots here and there. I know that for a fact. And like I said, even the most severe case of cystic acne, anyway, so the drug's called Accutane. It was originally Roaccutane. Its chemical name is isotretinoin, so it might be called various different things. The amount of lawsuits and everything going on are huge. The thousands and thousands of people that are living with permanent mental, sexual, and an endless list of problems after taking this drug for the spots when they're a teenager is huge. And you know, suicides, you know, a teenager ending their life because of a drug that clears up their spots. Yeah, do we need that? I don't think we do. I feel like I will always be trying to fill what is classed as normal, and I know that normal is very hard. You know, what is normal? But I think, you know, every single other person that's taken this drug and that feels the way I do or have done will know exactly what I mean when I say there's just always something missing, or, you know, the brain, the body, the numbness in certain areas, yeah. So sorry to be so negative, but like, you know, like I said, if one person watches this, that's teenage child is about to go and wants to go on this drug, and they say, oh, I didn't realize quite how serious it was, let me do some more research. If it stops, you know, please, how many adults, you know, that are walking around now, you know, 30, 40, that have acne, that didn't take the drug but had acne then? It would have been probably none. So it goes away. It's teenagers, it's hormones. Yes, it affects them, but we don't just take away all the other stuff that affects teenagers. Like, oh, I've got to go to school, that's making me, you know, it's part of growing up. There shouldn't be a drug for it because, you know, it's money. It's just money, and it's killed people and destroyed a lot of thousands of people's lives. Accutane, yeah, Dying for Clear Skin, the documentary was called, BBC. Yeah, I hope that it gets taken off the market. I hope they find a cure or a way for the people that suffer lifetime or lifelong, decades of irreversible conditions can get help. But that's not going to make people trillions and trillions of dollars or pounds, so I highly doubt it. Yeah, I'll leave it there. Bye.